Our opener. Good morning to everybody. James Rajat, Director of Strategy and Innovation here at UHHS. I am covering for Kyla this morning, who is unable to be with us. I'm excited to see all of you who have already joined, and I know we do have folks who will continue to join this morning as the forum begins. But for the sake of time and our agenda and our guests today, I want to get us started. So welcome to the November Community Advocate Forum on Medicaid renewals, which is your one-stop shop for what is happening, what has happened, and where we are moving forward in the next month or so. I would want to start by just letting folks know that participants can turn on their captions if you click more at the bottom of your Zoom window. So for those who would like the closed captions, we have enabled that so you can see the transcript, but you have to go to the bottom of your screen and click more in the Zoom window. So I just wanted to make folks aware that that is the way to enable that tech feature. And we appreciate folks bringing that question to us in a previous forum so we could make sure we address that and have that capability for everyone to participate in an equitable way. So with that, we can go ahead and look at our next slide and our agenda. So first, as I always like to remind folks, we can't do this without you. Thank you for joining. You being our eyes, our ears, and our key messengers, and having the latest information makes a world of difference out in the lives of our community members, in the trusted partnerships that you have. And as we move forward through this process, which has continued to be challenging, complex, but at the same time gratifying as we are keeping people covered, which is our end goal, which is keeping people covered, whether it is through Medicaid or through our transition to the exchange. So this morning, we will go through our traditional areas of focus with some additional detail provided in a few different components. We have our operational update, our communication highlights, our engagement next steps, and time for some open discussion and questions as we have, depending upon our timing today. So with that, I think what's next is we're going to start with our operational update from my colleague and team member, Chris Bresco, and other members from the ops side of the house.
Great. Good morning, everyone, and thanks, James. If we go to the next slide, please. So this is a slide you've probably seen before. So we call it our waterfall slide. It shows the dates that each cohort, the 60-day window for each cohort as they process through the renewal window. Right now, you'll notice Group 8, which closes on December 31st. Those renewal applications were mailed last week, the first week of November. So we're over halfway through our renewal unwinding process. Of note from this, cohort 9, which will be mailed the first week of December, will be our first cohort that will include families with children. Those will not see their first benefit decision notices or terminations in any way, shape, or form till the end of January 31st. So those follow-on groups, 10, 11, 12, will then also include families with children. We purposely put those towards the end of the renewal window so that we maintain coverage for those children and families with children. Next slide, please. This is a slide that's available for all on our Stay Covered website. Just some key points to take away from this. Up to the November cohort, or cohort 8, we have sent a total of 106,587 renewal notices. Of those, over almost 60,000 of those have been renewed passively or ex parte, meaning they required absolutely no effort on the part of the beneficiary. They were automatically renewed with data that we already had within our system. With that, we have procedurally had to terminate just short of 20,000. And that is a misnomer about procedural terminations. One of the things that needs to be recognized as we play into the term procedural termination is a failure to return documentation or requested documents or information that we would use to renew or redetermine someone as eligible for their Medicaid benefits. At the end of the pandemic, when the employment market went back up and people were back to work and started receiving employer employer medical coverage, or found another option, or their income was drastically changed. If they received a renewal notice, they may or may not have even taken the time to send it back, knowing full well that either they were financially ineligible or they already had coverage through another system. Something to keep in the back of your mind when you look at that number. It's not quite as dire as we say. And then those that have been determined ineligible, who had returned all their documentation, and who have and were still not eligible for Medicaid benefits, but were seamlessly transitioned over to HSRI and the quality health plan program, was only 4,000 out of that 106,000 total. So overall, a pretty good showing for the first 7 cohorts that have been finalized. Go ahead and go to the next slide, please. And then last but not least, I know we've had a lot of positive feedback on our scanning center at One Reservoir in Providence. There is a new document scanning center that's been opened up in Pawtucket on Roosevelt Ave. It's open 5 days a week, 8:30 to 4. But it also does more. You can conduct interviews there, eligibility determinations, and case updates and other support, not just the scanning of documents for our beneficiaries. So just another asset that allows people to update their documents and actually interact with Department of Human Services to ensure that their Medicaid benefits are properly processed. And with that being said, I know it's a very short update for me this morning. I will pass it off to Stephanie and our communications update.
Thanks, Chris. Hi, everyone. Happy to be here, and thank you for joining us today. Next slide, please.
I do believe we have a quick question. I see a hand from Heidi.
Yeah, just based on what you just reported, James, right? It was, or who just reported? Sorry.
It was me, Heidi, Chris.
Okay. Oh, sorry, Chris. Thanks. The Pawtucket.
The scanning center in Pawtucket. You went back on mute, Heidi.
Oh, sorry. What you said was being offered at the scanning center in Pawtucket, which is awesome. Is that also the same at Providence, or are they only just a scanning center?
It's just at both. So
I don't think a lot of people realize that, and that's really helpful. Like for me as a social worker to know that, to share with my colleagues as well. Because a lot of people are still thinking they can mail things in, and I don't think they realize that could really delay them and keep them from getting serviced in time. And so this is really, really helpful. And then what happened with the Holden Avenue?
That's still being worked. It's just not open yet. That's going to be the third. I didn't want to mention it because it's not open yet, but that will be the third scanning center that will be available. Now, you mentioned traditional mail, still a viable option if someone needs to send their documentation in that way. It's still perfectly acceptable. But just when you raise that question, we also can submit documents through the app, through the portal, in person at the scanning centers. So there's multiple options. We try to make it as easy as possible for people to submit that documentation so they can go ahead and continue with their benefits.
Thank you,
but
Chris.
thank you for that question, Heidi. Linda, how are you this morning?
I'm doing well. Glad to see you back, James. So Chris,
that hurts my feelings, Linda.
Oh no,
Glad to see James.
He has come back. Good, always good to see you, Chris.
We were happy to see him back as well.
Right. Thank you for the clarification about the procedural terminations. I appreciate that among those are some people who maybe did not return their documents because they have other coverage, or realize that they were no longer eligible. But one way to measure whether people are being terminated truly for procedural reasons is to see how many come back on. So that's churn, right? So my question is whether the agencies are documenting whether the people who closed, and now we have several months under our belt, whether people who have closed for procedural reasons are coming back on.
We have not tracked that. Now that we are a little bit more stable with our database and our ability to query, we're looking into that. There's actually the follow-up, and I checked with a couple of other states, Linda. No one is really tracking procedural terminations and the rate of return post termination. But those, and the other aspect of that is we still have that 90-day window where people are eligible. If they have missed their window, we accept their documents and we move to reinstate their benefits until we can go ahead and redetermine.
Right,
So
so
there's
having,
multiple
Yeah.
levels.
right,
It's
having the
very hard-
90-day window is great, but churn has always been an issue.
Yep.
Even before this, sort of the mega return to normal. So I think it's really critical for the departments to implement a way of tracking. I mean, I know the health plans can probably track for their members who's gone on and come back on again. So maybe in conjunction with the health plans, getting a sense of the true procedural terminations, again, is really critical because, we need to sort of disaggregate what's going on there. So I
Understood.
hope that you'll take steps to do that. Thanks.
And that's why I brought up that 90-day window is we're actively tracking how many of those were initial procedural terminations, resubmission, and how long it's been taking for them to have a benefit decision notice, while coverage, of course, is still maintained. Next step for that, Linda, is what you just mentioned, is finding out how many were procedurally terminated, and then how many of them had used benefits within the last 6 months is our first step, and then finding out, do they now receive additional coverage in another way, shape, or form? We're working towards it.
Okay, thanks.
Yes, ma'am. Always great to talk to you.
Same here.
If you don't mind, can I ask one more question? I thought Linda was going to ask and I forgot to ask.
Of course, Heidi, go ahead.
And this comes from someone who's worked in the field a long time with the older adults, especially, who really are, we've asked for the numbers, and I really think it's important that we know and we still I don't think we've gotten the numbers on, I don't know what we call it, older adults, 65 plus, 60 plus, but what amount of that group is falling through the cracks? Because I did go to one reservoir. I've been going like once a month for the past year just to see what it's like, what I refer people to. And it was really sad about what the lack of information was there, and the lack of effort by some of the people working there to get me, like, I asked for the short SNAP application. You should have seen the attitude I got. What do you mean? Like, what's that? Nothing listed and no attempt to find it. There's also this info sheet we've been talking about for almost a year, just basic resources for those who do fall through the cracks. And I just sent it to you, Stephanie. And I know Jim Beardworth was interested in this last year. And I think, is it Jose Diaz? I don't know if he's still there, but I remember I saw them outside the State House one day, and they said they were all working on this. But for those who accidentally fall through the cracks, or who just don't requalify, I really would like to see us make more effort to help this population, because this is going to cost our state a lot. And if we don't give them resources to help them, and we're going to get that attitude like, well, they're, and I said, we're doing this to help you. I've been volunteering all year. Like, we're doing this to help you, having to redo the work. Like, it's easier to qualify people now than to, wait 3 months or whatever it's going to take to get them back on. And they may become homeless. And there were no signs. The lack of information was really pretty dismal. And I just wanted to make sure, that we work hard to do this together to help everyone. And when we do this hard work here, but it's not being followed through in the offices, and I can't speak for all of them, but no signage, no real direction. It's very, very hard. And I think we have a responsibility to ourselves and to the state and to us as professionals, that when we send people there, that we know that they're going to get what they need. Even the way that the document center signage was, it's not the way it was. Like, the visibility was very difficult, and it used to be better. So I was hoping that someone could go take a look and just make sure that we're being consistent on how we message, if you don't mind me saying, because it really hurt my heart.
If Heidi, I'm going to put my email in the chat. If you go ahead and just put that all just give me a synopsis of what you just said. And I will share that with DHS, and we'll see what we can do to rectify that.
Just so you know, they've been saying we're working on it for the whole time. So but I have a feeling that you're going to help more.
Well, don't give me credit yet. Let me see what I can do. But I'll share my email, and please send that to me. I will share it with DHS and see what we get done.
And I do give you guys kudos too when I see it, but when you see something else, like, it's not about hurting feelings. It's about just trying to make things better. You guys realize that, right? I'm not
100%.
trying to diss anybody. Thank you.
Stephanie.
Thanks, Heidi. I also, I did just look at my email to see, because I know you said you sent me that resource sheet that you're holding up. And I'm wondering if you can check the link that I just put in the chat. I'm wondering if that's the updated version of that resource guide, the best ways to contact us flyer. But I also saw that you included Jose Garcia at DHS on your email, and he would be the best person as well to speak to the history of that document, where it is in the queue, and any updates.
No, not ways to reach you guys, but ways, well, yeah, I'll look, but like how to reach the point, how to reach the heating assistance.
Okay.
And because first of all, the writing is very, very small. And also it needs to explain what the point is, because most people have no idea what that stands for. So anyway, I thank you so much. It's just,
okay.
It's all in the end if we don't. And I've seen people come in saying, I need some information about LIHEAP. And I've heard from my own ears, we don't do that here. Like, that's not a no wrong door answer. And if that's the way we are, then we're all in trouble because, you don't want to see a bunch of old people sitting on this, becoming homeless like they are. And we're starting to see some of that increase. And so if we can help with that, I'd like to.
Agreed. Yeah. And as Chris said, and I know you and I've had this conversation before as well, if you can send us a write-up of those concerns that you've observed, we can do our best to work it from our side. So thank you for being eyes and ears on the ground. It's appreciated. I'm just going to really quickly walk through these. I've got just a couple slides highlighting some of the communications and outreach that we're doing related to renewals for households with kids. As Chris said, and I'm sure those of you that have been attending these monthly webinars know, households with kids are starting their renewals in December. They'll get a letter in the mail between December and April about their renewal. So we've been doing pretty detailed outreach and communications to make sure that those communities are aware of this timeline, know to be on the lookout for a letter from the state about their coverage, and know what to do for next steps or where to find support. Here I'm just outlining some of the channels that we've been using to date to ensure that the information is reaching those communities. We are sending out letters to the House, the Senate, and the governor's office this week to make sure that they and their constituent affairs staff are aware and can answer any questions that they may be getting from people in their community or in their networks about renewals. We're sending out an e-blast to all of our state employees and programs with a request to help share this message with their communities. We will be sending something out through RIDE, through their field memo that goes to all educational staff in the state. We will be sending out an update for childcare providers. We're getting palm cards to schools. We've been having targeted ad campaigns throughout renewals on social media, in out of home, in buses and bus shelters, as well as printed ads in local circulars and news, and radio and streaming as well. So those are all targeted as well to reach directly to the audience that we're trying to reach out to. Linda, I see a question from you in the chat. Stephanie, you just said families will get a letter about renewal between December and April. Will the last letters go out in April or in May for April renewal? The last letters, I believe, will be going out in March. Is that correct, Chris? March for an April deadline?
Correct.
Yes.
Thanks. I shouldn't have said May. But
I think I knew what you meant. Yeah.
Yeah.
March for April.
It does get confusing in terms of saying when the letters go out and when the renewal goes out. So, right, it's the last letters are going to go out in March for the April renewal, right?
Correct.
Okay. and it's the same, also when people are look for their renewal date on the lookup portal, it says their renewal date, the month of their renewal, but it's also important to note that the letters will come the month before the renewal date. So we're talking about letters between December and March.
Yeah, initially, Linda, we were talking, we were referencing cohorts as when their renewal notices would be mailed. And that just became very confusing. So since I think around May, we've been referring to the cohorts as the December cohort is the group who's will receive their notices at the beginning of November, but they will close their case, will be decided no later than 31 December, for example.
Yeah,
Right,
and from a communications perspective, we wanted to make sure that we were showing the full breadth of the window. And we thought that if we were saying December to March, it would imply that March 1 was the stop for, or would be the stop for any letters that someone might receive from the state. And someone might be receiving letters from the state throughout March, like their reminder letter or a thank you letter. So we just wanted to make sure that we were showing the full window of time where there may be communications happening.
I understand. I just think that for me, a consistent thing to say is that the letters to the families will be going out between December for January renewal and March for April renewal. I mean, it has to be the same, not like when you said December and April, it's the December letters for January, but it's the letters for April will go out in March. So we can't say December and April because then people think letters in December, letters in April, at least for me. So maybe others don't hear it that way, but just
apologies. We're not saying December and April. We're saying December through April or December to April. So it could be any month within that window where someone is receiving a communication from the state about their renewal.
Okay.
Karen?
Yes, I wanted to ask, I don't see it on this slide and it might be coming up, but one of the things that I know is being effective in places like Massachusetts are the large number of field workers who are door knocking. And I'm wondering what you all are doing, if there is a plan for that kind of direct outreach, specifically as we approach the renewals for families with kids.
On the communication side, we haven't been implementing any door knocking campaigns. James, I'm not sure if you can speak to the engagement side, what we have planned.
Sure. So on the engagement side, one of the items I was going to mention is that when we get to that section is that will likely be an allowable item within the next round of the mini grants for organizations to do on the local level. We don't have a statewide approach to doing that because of our existing footprint that we have, but we do want to make that available to our community partners. In addition, we are doing briefings with many of our other folks who do go into homes specifically for that reason as an ad hoc. So whether it's our family home visiting programs, folks who are out in the field for other reasons that visit homes, we are working across our agencies to do that and have them updated. We did that for Meals on Wheels originally when we were thinking about adults. So we are taking that same approach to have hopefully a very similar effect. But we are not like as a state going out with the specific canvassing campaign. However, we are going to make that available and are working with existing providers who are in homes.
Thank you.
Next slide, please, Sierra. Here again, I just want to highlight some of the resources we have available on our website for households with kids. On staycovered.ri.gov on our member educational materials page, we have a tab that just has materials specifically for households with kids. So we have included some examples here. There's a toolkit as well that has customizable robocall scripts, email content, and newsletter content, social media captions and social media images, and those are available in multiple languages. So our hope is that you'll consider sharing some of those messages through your network and with your community. We also have some updated FAQs there as well that include frequently asked questions about households with kids. Next slide, please. And next, I just wanted to talk a little bit about a press conference that we have planned for next week, next Wednesday. Our wonderful partners at Progresso Latino have agreed to host us at 10:30 a.m. So we'll be there from DHS, EOHHS, and HSRI, as well as Mayor Rivera from Central Falls, and a United Healthcare member, Melanie, will be joining us as well to talk about her experience and the importance of continued health coverage for families. And so, of course, you as our partners are invited to attend as well. We will be issuing a press release as well. If you're not able to join us in person, we will be happy to share coverage after the fact with you, and to make sure that you're aware of how that went. So we've included a list here of some of the speakers as well as some of the topics that we plan to cover there, including the 12 months of continuous coverage for kids, as well as the Cover All Kids legislation. And we will be having speakers in English and Spanish as well. And if you have any questions about that event, I'll put my email in the chat and you can feel free to reach out to me. Otherwise, I will ask Sierra to move on to the next slide and pass it back off to James.
Great. So I'm here to talk about our engagement next steps and some reminders for folks, and to give you some additional information that we have to date. And so we can move forward into this section, and I will cover it as best as I can. So just as a reminder, when it comes to our community engagement, we had several different goals. We had starting with our identified messengers that are trusted in our community and fostering connections with our local champions. We've been ongoingly doing that, whether it's through those of you who have joined here, working with family-focused organizations that we're building relationships with now, partnering with our health equity zones, regional prevention coalitions, homeless service providers, all of those types of things to be focused on at the most local reach that we can have. This forum and providing of the mini grants and all of these types of resources on the web is to create collaboratory spaces so that we can tailor outreach. So we've received numerous materials from the managed care organizations that we've helped to tailor, from many of you on this call, such as the Helper Handbook and a variety of things that we welcome, being able to help expand and have a collaboratory process. There are some one-pagers that were developed specifically because they were end-user generated from you all. So again, we really have valued that as we continue to move forward, and have put the time and energy into that. And I want to thank Stephanie, Kyla, and Sierra specifically for making that time available, and then also to Chris, Lisa, and a variety of others who operationally have added time into their day to specifically make sure that we can get these resources out. The mini grants help to provide skill building opportunities, whether it's through counselor and education and a variety of other items. And then we have continued to try to use a data-driven approach as we move forward in our renewal process and continue with the dashboard. So we'll go into a little bit of where we're headed. Next slide. So I just wanted to provide a recap. So we've had a total of $130,000 that have gone out through 2 sets of mini grants. You will see the majority of those funds have gone specifically to outreach and to fund outreach, which is what most folks had told us they needed. But I am happy that we've been able to support technology, some training, as well as language and cultural competency for those who wanted to increase their reach, or with either the language line or other things like that. So very happy to report what that looks like to you all today. Next slide. Here's a list of some of our mini grant partners. This is not meant to be the extensive list, nor to leave anyone out, but we did want to just share that we have a variety of types of partners who have engaged with us through a variety of geographies, representing a variety of demographics. Next slide. So far, reporting from our mini grants, we've served in over 5,000 unique individuals in our priority populations. We have 21 new certified application counselors that have been resulting of these funds. We've had 53 targeted specific events that have been held in the community by the community, and 153 applications that were processed through direct assistance of these trusted partners in the community. And I think all of these are great for us to be able to share with you that the work is happening out in the field. And again, it is to you and your partners that have been doing it. And I cannot, as the state, take credit for that. I have to say thank you, community. Next slide. We don't have the numbers on here. I think they got cut off in terms of the percentages, but I do just want to show you as an order of magnitude that the languages served. We have a variety of our non-English speaking population that has been served through these mini grants, and that is important for us to highlight and remain vigilant to. Next slide. Similarly, across our priority populations, this goes to show you the different types of populations that we are serving through this, including those who struggle with addiction, those who may be homeless, our seniors, the BIPOC community, those that might be dual eligibles, have previous incarceration history. All of those who are most likely to be left behind through this process are indeed the areas of focus of these mini grants. And again, kudos to the community for stepping up. Next slide. I think at this point, I turn it back to Stephanie, but before I do that, I will just say that again, we will let you all know when new round of mini grants come up for this next iteration of our work, and look forward to continuing to provide you these types of information and data points as we move forward and do a summative report of the work that we have done through this engagement process.
Thanks, James. Oh, Sierra, could you go back? Thank you. We just like to keep this in every month. I know this looks familiar to some of you, but just in case there's some new folks on the call, and there's so much information about renewals and so much nuance that we like to try to zoom out and give you high level some of the key points and key takeaways, ways that you can help us get the word out. Of course, to visit statecovered.ri.gov to download educational materials you can share with your networks. Information is available in multiple languages. If you need assistance printing, we can be in touch and work on that as well and provide you with some printed copies. We have some key messages at the bottom there as well. As mentioned, households with kids will get their renewal notice between December and April. You can update your contact information now and sign up for text alerts to be ready. Watch the mail for your yellow or green notice from the state of Rhode Island. Open your mail and take action right away. We want to make sure that families know that a dependent may still be eligible for Medicaid, even if their parent or guardian isn't eligible. So we encourage everybody to make sure that they return their renewal forms. We want families to know that help is available near them and that they can visit statecovered.ri.gov to find assistance. And that remember, these renewals will happen again each year moving forward, as they did before the pandemic. And that's it. I think we just want to open it up to any other questions that the group may have.
How's the outreach going so far? Like I had a question about pharmacies and stuff. Like, how's the reception? Because like I mentioned in the notes, I'm noticing that some of the pharmacies that had things listed before, they've taken them down or people have pulled them off. So how do we, like, yeah, so I guess that's two questions. How do we get that back up there? And what's the response been so far as you get out there to places like pharmacies and other places like that?
So I can say that similar to when Stephanie mentioned that we are planning on getting new information back out to state employees as we enter this new process, we want to take that as a lesson learned. And your point is well taken around maybe we need to re-emphasize that with some of our other venues such as pharmacies and other things like that. So noted, if that's not in our existing outreach plan, we can certainly add that as a component because that is a great point. In terms of initial outreach that has happened, we've had some community events related to households with kids, particularly around some of the back to schools. Reception was very good. We went through all of the supplies and information that we had. So there has been a very good uptake. I can say on the state level, our agency partners such as RIDE and others who work with children have been extremely receptive to partnering with us and are planning specific information that they want to send out. And that's really where we learned about things like palm cards or magnets or other things that we should be creating to help assist folks in this process. So I would say that engagement, even personally in speaking with folks who have been out, when I've been out in the community, has been great. Folks have asked really good questions, and they seem attuned and aware of what's happening. So I think from a messaging standpoint, we've worked really hard on the communications. I know folks have said, oh, I work with this community partner, which has also been great. So our community partners are informed. But then when we're actually doing that outreach, I have had good engagement so far. I'm welcome other members of the team to share, but definitely that's my personal experience. Karen, I see your hand.
Yeah, thank you. I may have missed this because I was having trouble signing on, but are you tracking appeals and the filed appeals and number of resolved appeals and such? Is that on the data portal? Did you guys report on that here in this meeting, or did I miss it?
So we did not report on it in this meeting. There is appeals information that is being tracked in that is, I believe, required by our CMS partners. I will turn to Chris Bresco if he has. We didn't share any of that, but I believe it is on our data dashboard, but I'm not the expert on the appeals.
I'm sorry, could you repeat the question one more time?
Whether or not we've been tracking the appeals and all of that, and if it is available on the dashboard. We didn't report it here because we haven't been focusing on that.
No, we did not report it, but yes, we are tracking appeals. We did have a technical glitch that was causing a false number to be reported through the Rhode Island Bridges system. Right now, we currently have 160 outstanding appeals. But with that being said, last month we brought on board 3 new hearing officers to help with that backlog, and they are onboarded and are at work now. So we're hoping to move through that pretty quickly. All in all, for 106,000 plus renewal applications going out and less than 200 appeals pending, we're looking pretty good. But that is reported on the state covered website.
And are we beginning to understand the outcomes of those appeals?
In terms of are you looking for a percentage of reinstated or continued benefits versus denial of benefits?
Exactly.
I don't have that at my fingertips. I know we are tracking that through the appeals office. If you want, again, Karen, my email is in the chat. If you're looking for that number, I can go ahead and try to get that for you.
Yeah, that would be terrific.
Remember though, a lot of the appeals we get are people that are just asking questions, and they're actually resolved what we call informally. Informally resolved means that they never went to a fair hearing. The customer was satisfied with the answer they received. So when I say give that number of 160, those are fair hearing appeals that are awaiting adjudication through the hearing process.
Correct. I understand that. I just think it's an important indicator to track over time. So thus my question.
Sure, understood. Yeah, appeals were something we actually focused on prior to beginning the unwinding process, understanding that would be a key metric and a key indicator of our success or failure in the program. So a lot of work was done between the appeals office at OHHS and DHS to ensure that process was smooth and kind of worked in the manner that it was supposed to. So the informal appeals, the informal resolution of appeals has gone way up, which of course then brings down the fair hearings. But
Yes.
Understood, that is a key metric.
Yeah, it's definitely a key metric. Even the informal appeals and the resolutions of those, I think, is an important indicator. And I'm not sure if you guys are tracking those in the same way you are the fair hearings, as you call them.
That I actually can't answer. I can find out. I can ask the question. I had not thought of that as a separate and distinct metric. I apologize.
No worries. Thank you.
Yes, ma'am.
And Chris, I believe in the chat there was one talking point that Heidi was looking to confirm around the redeterminations that had to happen because of unwinding.
I did not see it in the chat, James. Heidi, do you want to just go ahead and verbalize it?
Yeah, the total number of redeterminations you have to do or had to do, what was it, that number again? Was it did I hear 160?
What we've done up to this point. So with the 8 cohorts that have received the renewal notice up to this point, it's 100 and the exact number is 106,587.
But total, like, do you anticipate for this whole process?
That number was just around 300. I can't give you an exact number, but 370,000 ish.
Wow.
So, and this was done purposefully, was to start off lower, exercise the process, get the systems in place, and then build the volume as our capacity increased.
I mean, that's massive. That's a third of our state about, and wow. And you guys are still looking sane.
Well, it's a plan. It was a plan. It was a planned process.
Right.
And
And
if
then
I could,
Oh yeah, go ahead.
Heidi and Chris, Mike Cronin, how you doing? Chris, out of the 370, that's our total members. Many of those will be passively enrolled. Am I correct?
Right. That was my next point, Mike. Thank you for bringing that up. Is we are still averaging well over 50% passive renewal, which is, it does not require worker intervention. So the number's not, 370 sounds like a huge number, but really basically cut that in half. Thanks, Michael.
And if you don't mind, how's the phone system going? I know there was a big call drop report last time that I saw, but is it getting any better?
It is getting better. Director Brito's put a lot of effort into the call center, and in conjunction with assistance from HSRI, the time is going down, but the call volume is up. The call volume is steady, and it's heavy. But realize that call volume is not all Medicaid. That's all programs. So it's, and we now have the ability, as of this week, believe it or not, to separate out Medicaid, be able to tell us numbers exactly, Medicaid versus other programs. So you'll be seeing that soon.
Well, and this is Linda. I just wanted to mention too that as the families start to renew, they're all Magi, right? So they all can be calling the Health Source RI call line, which should ease up. If we do a good job of advertising that would ease up on calls to the DHS call center, which, as you note, Chris, really gets a lot of calls about SNAP, Rhode Island Works, childcare, and other programs. The elderly disabled folks still need to be calling DHS, but if we push, we really make it clear that if you need help with renewal or documents, you can be calling the HSRI call center. That would be very helpful, I think. I realize there can be some concerns about doing that, but that really is the best way, I think, to relieve some of the volume for DHS.
That's a great point, Linda. I appreciate you bringing that up.
All right. So as I put myself on mute, as always. So with that, I want to thank everybody for attending. I think these are really wonderful questions. I want to give kudos to the team from our community that has created the appeals fact sheet, as well as the helper handbook that are in the chat. Those resources are available. I want to thank everybody for their time and questions today. Stephanie has her email in the chat. If there are additional questions, please send them to us. We will work to answer them in the interim or present information at our next forum. We'll continue to communicate with you electronically as we do. And I very much appreciate everyone's time, the thoughtful questions, and again, your continued partnership, because it is this work together that has made this as smooth as it has been, despite bumps in the road, which we always acknowledge there would be. But again, it is really, 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 really critical that we continue to stay engaged with you and that you continue to stay in tune with us each and every month. And I hope this continues to be as informative as we intended it to be. So again, thank you. And I promise the more fabulous Kyla Walters Clinton will be back in my place next week. But you got team player B today, and I appreciate each and every one of you. So have a wonderful day. Enjoy 15 minutes of the gift of time.